Is it too late to start estrogen if you're 62 or younger? Well, the short answer is probably it's safe for you and there's many more benefits than risks. Hi, I'm Barb Dean. I'm a women's health nurse practitioner, and I am getting this question all the time now because women are now understanding that there's many more benefits to using estrogen after menopause than there were risks. Because back in the day, we were told all about the risks, even though there were tiny, tiny, tiny risks, and not about all of the amazing benefits of using estrogen. So estrogen is a natural hormone that's been in our body since puberty. And estrogen is what gives us curves, right? It helps with our softer skin. It enables us to have a menstrual cycle every month, and it's one of the key hormones for fertility. So it's a natural hormone. There's a lot of confusion out there about hormones, bioidentical, natural, synthetic. There's a lot of confusion all about menopause and what's best for you. So let's start with the basis. Many of us were told about all the risks of estrogen, that there was an increased risk of breast cancer, there was an increased risk of heart disease. But the study that was based on was deeply, deeply flawed. And now, 20 years later, there's more and more and more evidence that tells us there are many more benefits to using estrogen than there are possible risks. Also, not every estrogen is equal. So there are bioidentical, FDA-approved estrogens that come as pills, patches, sprays, even gels that can be applied on the skin. The pills are taken orally. All of these estrogens are bioidentical. That means that the molecular structure is equal to what your body produces. And if you have a uterus, if you have not had hysterectomy, if you use estrogen, you must also use a progesterone-containing product because that helps balance the estrogen, and that helps reduce the risk that the estrogen will cause the uterine lining to grow up with too much blood, causing a precancerous or a cancerous condition, and so progesterone helps balance it. I typically recommend only one type of progesterone, and that is a bioidentical micronized progesterone, which has the trade name of Prometrium. So let's go back. Estrogen is that natural hormone that's been in your body. And estrogen not only preserves bone mass, it helps us sleep at night. It helps reduce depression. And it also helps us keep our cardiovascular system very healthy. So women who use estrogen during the perimenopause and menopause transition, their blood vessels, the blood vessels around their heart, all through their body, and the blood vessels in their brain are more flexible. They're less likely to develop atherosclerotic plaque. That's that plaque that builds up inside a blood vessel that can cause a blockage or a narrowing, or it can cause a clot to be thrown and cause a stroke or a heart attack. We know that estrogen is cardioprotective in the first few years after menopause, right? So I want you to remember that, because when we say who can take estrogen and how long after the last period is it safe, we use a 10-year window. That means that if you are 51 and you stop having periods altogether, you have 10 years. During that time, you can safely use estrogen as long as there's no other contraindications. So during that 10-year window, adding estrogen back into your system will not cause heart disease. It will not cause a blood clot. But after that point, let's say it's 15 or 20 years after your final period, or after that normal age of menopause, let's say you're 68 or 71. By then, you've had some time for that atherosclerotic plaque to build up in those blood vessels. And guess what? At that point, if you add in estrogen, that's when it can cause a blood clot. That's when it can cause a heart attack or a stroke. So not in the younger, healthier women, even women who have high blood pressure, even women who have diabetes. If they're within that 10-year window, then the thought is they probably have not developed that atherosclerotic plaque, and using estrogen is not going to be risky. But if you're concerned, let's say you have a family history of heart disease, let's say you have high blood pressure, or you're taking a medication to lower your cholesterol, a medication known as a statin, then you can ask your primary care provider or your women's health provider to order a coronary artery calcification score. What does that do? It tells us, hey, is there a lot of atherosclerotic plaque in those coronary arteries, those small arteries around your heart? And then you and your provider can make a personalized decision about whether using estrogen is a safe option for you. But for everyone else, for women who are within those first 10 years after their final period, or those first 10 years after the age of 51 to 52, which is the typical age of menopause, then using estrogen has far more benefits than risks. The benefits are that it helps preserve bone mass. We know that women who use estrogen, they typically do not have as much depression. Now, we don't use estrogen to treat depression, but estrogen is a precursor hormone for serotonin, that feel-good hormone that's in our brains. As estrogen levels drop, serotonin levels drop. Serotonin receptors, there's less of them, and it's less likely that they can uptake serotonin. So when we use estrogen, we help our body's natural feel-good hormones work better. Again, estrogen is not a treatment for depression, but many women find that when they use estrogen, not only do they sleep a lot better, not only do they have fewer hot flashes and night sweats, but they're less likely to be anxious or depressed. But of course, if you have an underlying depression, an underlying anxiety, talk to your healthcare provider about the best way, the personalized way to treat that for you. We also know that estrogen helps preserve collagen, not just the collagen in our face to reduce wrinkles, but the collagen in our muscles and our joints. Many, many women have muscle and joint aches after menopause, and they chalk it up to osteoarthritis or another rheumatology issue or from overexercising. But the most important thing to remember is that estrogen will help preserve collagen. And by the way, you cannot absorb collagen by drinking bone broth. Your stomach doesn't absorb collagen that way, but estrogen helps build it from the inside out. So when people use estrogen, they find that, you know what, my muscle and joint aches aren't so bad. It's not a cure-all. It doesn't take care of everything, but it can help you feel a lot better. And there's another area where estrogen helps, and that is putting collagen back in our pelvic floor muscles. So using estrogen for the full body, for hot flashes and night sweats, can also help our pelvic floor muscles be stronger so that we can do a Kegel or squeeze those muscles and not leak urine as often. But some women find that whole body estrogen, that the one that they use for all of those benefits, there's not enough targeted for the vagina and the what we call the urogenital system, for the bladder, for the vagina, for our sexuality. And so many, many women, including myself, use vaginal estrogen. So we use a localized estrogen that is just for the vagina, and guess what? It stays in the vagina. It does not circulate through the whole body. So women who use vaginal estrogen, it's not adding on to the other estrogen they may be using throughout their body, like the pill or the patch or a spray or a gel. So the vaginal localized estrogen is used in many, many women who are on tamoxifen, myself included, who are not using full body estrogen, but are using estrogen just in their vagina to help with their bladder, help reduce the number of bladder infections, help reduce odor and itching, because when we use vaginal estrogen, it also promotes a healthy pH. by allowing the normal, healthy lactobacilli, that's the normal bacteria that live in our vagina, it allows them to have enough nutrition so that they can thrive there, keep the pH nice and acidic, which prevents the overgrowth of harmful bacteria that can lead to bladder infections. So whether you have a partner or you're flying solo with your own sexuality, vaginal estrogen is something you should consider for your long-term health and your safety. When you think about whether or not you should use estrogen after age 51 and then beyond, you want to think about what are all the benefits. Are you having hot flashes and night sweats? Yeah, if you are, it's going to help. Do you want to preserve bone mass? Check. Do you want to sleep better? Do you want to reduce the likelihood that you're going to be so exhausted that you're just kind of sleepwalking through your life? It also can help. Do you want to help with muscle and joint aches? Do you want virtually every part of your life to have a little bit higher quality? Then estrogen might be something you can consider. Remember, if you have a uterus, then you'll also want to take a progesterone to balance it out. Whether you use estrogen through your entire body or just in your vagina, if you use it just in your vagina, it helps with your pelvic floor muscles, it helps reduce incontinence, it helps reduce urinary tract infections, helps reduce odor, itching, and irritation. So that's something else you might want to consider. Look, if this has been helpful, please click like and subscribe. You can also leave comments and questions below, and I'll get to them as soon as I can. I'm also doing a video on women who had a hysterectomy in their 30s or 40s. So you can head over to that video if you have questions about, is it too late for me if I had my ovaries removed before menopause? That's a very, very important topic. And the take-home answer is that estrogen is very protective. And for those younger women, it's recommended that they do use estrogen as long as they don't have any contraindications. So I hope this was helpful, and I'll look for you in the comments section.